Welcome to another episode of The Change, where we introduce you to the people and ideas shaping MENA region. Our guest today is a top-performing IT director with 20 years of experience managing business application, IT services, networks, data centers, and IT security in healthcare. Over the course of his career, he has been successfully designing and managing IT infrastructure for some of the biggest hospital groups in the region. Today, he is the IT director of Zahra Hospital, the largest private hospital in the UAE. Without further ado, I would like to welcome Mohamed Gamal.
Thank you very much. I'm very happy for your invitation. I'm very happy to be here with you.
Thanks, it's my absolute pleasure. So, Mohamed, tell me about the role of Group IT Director of one of the largest hospitals in the UAE, and how did you ended up with that role?
Well, it's a very important role in healthcare organization nowadays. The role of IT or the IT department and managing this large number of resources in a large healthcare provider is really challenging. First, I oversees the IT department or information technology department in the hospital, work in the middle layer between the C-level and the customer or our patients who come and visit the facility or the hospital to take their treatment. So I apply the strategy from the organization and work in between to execute the digital strategy and other strategy to maintain the data and data flow in the organization, supporting the caregiver and the clinical team to deliver the best class in the technology for healthcare industry in other hospital.
Comes with a bigger responsibility, I guess.
It's true nowadays, yes, because the IT director is not like before working only on the technology or a technical area, but now they have shifted and moved to work more with the caregiver and the clinical team to decide on many things like deciding on what data to be collected, what data to be processed, how data will be visualized to help the patient, help the business, and how they can maintain the data grow or the digital data collected for the patients and the caregiver, make it more meaningful and more useful for both of them.
There's a lot of things on your mind, I'm sure. You've been around for more than 15, 20 years and in the industry and with your current role, and you've seen a lot. What has changed in your particular role over the course of 20 years, being in charge of, IT, technology, digital data in 2000s, comparing to being in charge of that in 2020s when we are completely technology-oriented, technology-savvy, where we're using data to drive our decisions, to improve patient experience. What has changed over these 20 years?
I think the major change is moving from financial-driven or technical-driven rule to a clinical-driven rule to decide on the success factor for implementing any piece of technology in a healthcare organization.
Can you unpack that a bit for me, this comparison?
Like before, the IT resources used to work only the technology, align themselves for what is new in the technology, following this concept for a very long time, regardless what is exactly the business need from the technology. What make the business success financially. But here in healthcare is quite different, especially in the last 15 to 20 years. Now we have electronic medication system and our electronic health system where it cares about the full cycle, full workflow for healthcare to cover the entire journey electronically. So moving from that direction, financial driven or technical driven, to clinical success driven, means you work more with the clinical team, not only the financial team. Of course, IT works with everyone. The success factor for any IT director or CIO is not to isolate himself completely from the operation team and work technically. No, you want to meet with your physicians, your nurses, as well as the top management, patients, to analyze what is the technology needs and how to cover each and every workflow electronically or using the technology. Sometimes you decide what data to be collected in the mHealth to qualify this data and quantify this data and make it meaningful, as I mentioned before. So initially, or before, a very long time back, the CIO or the technical resources was not getting involved to that level. They will just apply and design the forms or the system requested for just simple data collection to share it as it is using the technology.
But it makes sense. I mean, some time ago, and not so long ago, IT departments were usually looked at, people who are behind their computers and doing some software things just to maintain our system so that everything works, and you approach them only if you have a bug on your Windows, and Windows doesn't want to open Word. But today, IT department transformed, and it's supplementing almost all roles within the organization, especially hospitals, with data, with technology, with tools which are helping them make better decisions.
That's true.
And so on.
That's true.
Mohamed, having this in mind and the complete transformation on IT department in advances of technology over the previous couple of decades, let's say, how did this influence the overall quality of the healthcare that patients are receiving today?
If we look at the core patient rights when they visit a facility or a healthcare provider, what they mainly need. They need treatment. They need to receive the proper care to heal their pain.
Yeah.
Second is they have fear. And for this fear, we are not talking only about the direct treatment, but to show the empathies and show the real care in each and everything from the time they call the healthcare provider, or the time when they wanted to visit the hospital. So it started from the access to care.
Access to care,
and this is one of the patient rights, by the way. And how we
everyone has the right for access to care.
Patient education, sharing of data. There is a lots of patient rights that we have to maintain in all workflows when we think about patients and patient safety. And access to care is nowadays completely changed. People used to book appointment or find a healthcare facility using only the phone, calling for asking about their caregiver, getting some information, trying to find who's the best physician or healthcare provider to heal their pain. Nowadays we shifted to multi-channel call center and providing different channels for the patient to make it easy for them to reach the facility. And then now the digital channels where we have portals, we have mHealth, or we have mobile applications. We have now chatbots even that can take the query quickly from the patient support or help them to identify which clinical area exactly they want to visit. Some of the patient, even they don't know which clinic I should visit. I have pain in my ear and I have I'm coughing and I have this and that. There is also smart application or robots even that help the patient by chatting with them, collecting the initial information about their pain to help them to identify which caregiver they can support them. So this one channel. We are talking about lots of channel from the time the patient visit the hospital, how we document the visit, how we do the treatment for the patient, how we identify the right medication for the patient.
So first thing, if we need to say 1, 2, 3, 4, first thing that was extremely improved is the access to healthcare, right?
Yes,
using all of this channel.
one of the improvement.
And now we're stepping into how the whole healthcare service has been improved.
Yes, exactly. How the service itself is introduced and given to the patient. If we are talking about the electronic health system, from the time we start the assessment for that patient, collecting the required data, vitals or risk assessment, to process this data and make it more meaningful for the clinical team to identify first the diagnosis, the disease, or even though the order sometime for the patient. We give, of course, we are not taking the lead to decide on behalf of the physician.
Yeah.
But we give a support for the decision, and there is lots of tools and lots of technology nowadays we have introduced to make it this easy. If we are talking, for example, about the electronic health system, is one. If we are talking about, let's say, drug support, drug interaction support at the time of ordering, I can show the physician based on the history, based on the patient health, I can show to the physician if there is interaction between the drug he's ordering now to the patient, and the drug means medicine to the patient, and any other drug he have, home medication, for example, or drug to health, if this is not matching with his age, with his weight, with his gender. If there is any interactive between drug and alcohol, drug and food.
Yeah.
So this is all, we call it decision support system. We use a lots of algorithm to come up with this support tips and hints to the care provider.
I was super amazed when we initially discussed it in our preparations for this interview. I was super amazed with the amount of technology that is behind the service that we are receiving, that is not visible to the patient. Usually, from the perspective of the patient, I come in, I get the treatment, usually interact with the doctor. They told me what's my diagnosis, they give me the treatment, I go to the pharmacy, I buy my medicines, and I go home. While in the background, there is so many of the systems that are in place to supplement the decision making the doctors are facing, right?
That's true.
What are some of the backbone systems behind the one healthcare service provider that you would emphasize as the key technology stacks behind the service?
If we are talking about the integration, what does that mean? That we connected the component of technology all together.
So all of the pieces of technology to communicate between each other and work seamlessly. Yes.
We have the algorithm, how we can do this. We have the knowledge from the clinical, where we connected we have the technology and the technology resources. We connect all together to make sure that the data flow is easy between all this component and come up with ideas and solutions to the healthcare provider. Many people also are using the big data and big data analysis to identify, for example, the risk factor for one of the admissions, or the readmission factor, whether it be high, low, how we can eliminate this readmission if someone is about to discharge from the hospital or the facility, and there is a high risk factor that he will be admitted again to the hospital because there is a gap on the workflow. There is a big data analysis done, and prediction is done on the existing data to identify this element. There is also AI and machine learning. Lots of healthcare organizations nowadays employ AI and machine learning to identify the diseases. And if I want to give an example, we should think about Ebola, for example.
Ebola.
Ebola, the AI and the machine learning had identified the Ebola as an epidemic 9 days before the World Health Organization announced it is epidemic.
Wow.
Using the algorithms to scan and learn about this huge data collected for this virus.
I'm curious, like, are we anywhere near? Obviously, AI is getting more traction and traction. We're using AI in a lot of business cases across a lot of industries, but healthcare is a very sensitive topic. Are we anywhere near the situation where AI will be used for some decisions more than actual humans, and that we're going to trust AI in some cases, not all, but in some cases more than we trust humans when it comes to healthcare?
I think in 5 or 10 years, the AI and machine learning will play a big role to replace a human in different area, not only in healthcare. For healthcare, if we are talking about image analysis or lab or laboratory result, and reporting for this result can be done by machine or AI. This is quite possible, and nowadays we have heard a lot about this technology where the computer can analyze hundreds of dimensions faster than human. The maximum dimension the human can analyze is 7 dimensions in parallel. If I give you a math problem and I give you 7 dimensions, your brain can use these dimensions all in one time, maximum 7. Machines is different.
Sorry for stopping. Well, let's go a couple of steps back so we can explain this to us normal people so we understand. To try to simplify that and explain this to a 5-year-old.
All right. If
probably through an example, how are we going to use AI tomorrow with image processing?
Image processing relies on algorithm plus knowledge. If this knowledge is hard coded for a machine, and we know how we can do a comparative analysis for this images using the existing knowledge and the algorithm we have, then it is easy for the machine to identify what is the outcome from this image.
I see. So if I would say that in my own words, we would use machine learning to analyze huge amounts of data on, for example, previous x-rays of brain, so that next time when a patient comes in and they do the x-ray of their brain, AI can process the image and tell you confidently whether there is a chance of tumor or cancer based on the knowledge from the previous results, right?
This is one, a history of data is one, and the clinical knowledge which we can hard code in the machine to, think about it, it's a book. You write everything about what is required to analyze an image or cancer patient. So as much you code, as much you get more accurate outcome. We're still in the beginning, but I think in the near future the image analysis will be fully automated or used by the AI in healthcare. Still, the human does not trust the machine, fully trust. If you go to a clinician and they will tell you that you will be diagnosed and you will be treated fully by a computer, I don't think you would feel good.
Yeah, well, probably will look for another doctor.
Exactly. You report this to the police, so you will not believe that. Still, you need the empathy and to have the human touch, and the feeling of human to cool down your fear.
Yeah.
This cannot be replaced. And not now, and not even in the future. This one I'm thinking.
Yeah. What about robotics?
Robotics, I think it's increasing day by day, and lots of provider and healthcare workers started to employ more robotics to change the practice. as of now. Moving from digitalization to automation require lots of work to redesign the workflow for healthcare work. If we're talking, for example, about robotics processing, where we are taking queries online and process these queries, opening tickets or sending these queries to second level. This all now automated. And lots of similar work has been automated to very extensive level. When it comes to customer service, for example, how we can take queries online, process this query without any human intervention to get the patient appointment using the free busy time windows in the back end from our system, offer him the suitable time he want to visit the clinic without any human.
So that's improving the overall experience, but more on the administrative part to a certain degree, and improving the quality of the service, provided service. But what about if we're talking advanced robotics and actually facilitating surgeries through remote access to robots who are actually executing the surgery? Is that anywhere near?
That is already started, and we have lots of example, lots of technology. I just mentioned one area, which is a customer service for our audience, for them easy to understand. But yes, there is robotic surgery which is started a very long time back. By the way, it's not new, but it's not with each and every care provider. First, because of the cost and knowledge, lots of reasons, but it is there, and it plays lots of a big role to change the game now, how the surgery being done. So there's a new development to make it more accurate, make it more beneficial for the patient. If I'm using this technology and I can allow more caregiver to connect physically or remotely to this tool to give or deliver better care to the patient who's now receiving the treatment in the operation room, then I achieve the target to reduce the risk for that patient or improve the outcome of this operation using the robotics.
Sure, makes sense. And obviously, given the whole circumstances and the situation with COVID-19 this year, I'm sure nobody expected that, especially not hospitals, that this is going to happen. You were under a lot of pressure, and there is a lot of strategic decisions to be made for the future, right? I think that patients will definitely change some of their expectations and habits for good. Interesting information was that we noticed that there is a huge reduction of the hospital visits. So there is a question, why did they visit the hospital in the first place, right? But how do you see new patient experience of the future, patient experience in 2021, telehealth, remote access? How will that whole process be kind of changed and developed further?
Actually, COVID epidemic comes as a trigger for all healthcare provider to change the way they do the business.
They get used to and kind of relaxed about.
Exactly. They used all the model where the patient come to the facility physically to receive the treatment. But can we say that even though with COVID, there is no other diseases? There is no other patients. They are there. They are not coming to your facility, but they are there. They want to be treated, and they have a problem that need to be solved. That means that we only need to change the way we do the business. I don't want to call it business, how we deliver a treatment for the patient. And technology plays a big role in this. If we talk as an example, the telemedicine or telehealth, where now you can see lots of providers have introduced a teleconsultation. Patient don't need to come physically to the facility to get their treatment. using a video conference tool and using a telecommunication tool, we can connect the healthcare workers with patient to get their treatment and deliver medicine to their home. Telemonitoring for patients who's having a chronic disease or older people who cannot visit.
What exactly means teleconsultancy would be basically patient is getting in touch with the doctor through conference call, for example, and you're having a chat. Next level is telemonitoring. What is telemonitoring? How is that?
It's all under telehealth umbrella. Teleconsultation, yes, remote consultation. There is also exclusion or exception from this teleconsultation. We cannot give a treatment for people who's having emergency over telemedicine. Also, there is for some physical examination or physical diagnosis cannot be done also fully on a teleconsultation. Telemonitoring, if we have a chronic disease, let's say that we have a cardiology patient or a patient who have a disease and it require a continuous monitoring for their, let's say, blood pressure, heartbeats, or this and that, we can help the patient monitor their health and report their health status directly to the healthcare worker without need to have a healthcare worker with them.
Which is amazing.
Exactly. So we are saving time and also it works for the patient health, because if we are able to identify the risk or predict the risk in advance, then we work for to increase the patient safety.
So this basically means that today, so if someone is in a critical state, they will either need to be hospitalized and stay in hospital, or they would stay at home with a health worker with them non-stop.
Depend on the condition. I cannot answer this.
But what can happen in the future is that patients can stay at home, being plugged and attached to devices that are tracking their condition, submitting the information through different technology and digital channels to the hospital system, so that you can remotely provide them the care and monitoring.
That's true. We're talking not only about telemonitoring. We have telepathology, teleradiology.
Wow.
In case we need to collect, for example, sample from that patient, blood sample, we can do it. You don't need to visit the facility, but we can use one of this telemonitoring equipment to do it quickly and save the patient time. Using the data which is also collected, it have a meaningful for the clinical team. I'm not a physician to give many examples about that, but maybe the blood pressure, the blood oxygen, the heartbeats, this, if you collect this all together with each one having different value, it have a meaningful data for them, or a trigger to take action. Okay, I might need to send you ambulance now. I might need to collect a blood sample now, urine sample for the next course of action. Yeah, so it's important, and nowadays because of COVID, it increased this kind of treatment, the teleconsultation, telemonitoring, and everyone think about the current situation. Yes, we got hit like any other industry because of COVID, less compared to, of course, retail or construction or aviation. But yes, a lot of patients are scared to visit the facility, and we have to think about different ways to deliver treatment using technology to our patients.
Well, but it's interesting that the technology existed even before, but the awareness and people willingness to try it out was not at the level where it is today.
It exists before, but not at the same level where we are now. If we're talking about wearables and how many wearables are FDA approved, the high accuracy to collect data about your heartbeat or blood pressure is less before. Now, yes, every day we hear about smartwatches and lots of wearables or devices that can collect this information, and the accuracy is quite high, between 90 and 99%. And this is very important. Yeah, technology is there, but was limited. Plus also the adoption, which is very important factor for any technology to success, or if you want to implement it successfully. The healthcare worker themselves, they have to adopt the new technology, not to think always about the old model and physical interaction with patient.
No, it makes sense. And where do we stand today with how much is all of this teletechnology being actually used?
You cannot tell. It's you can find it everywhere. No, it's not like that, because lots of limitations there. First, it could be the regulation. Lots of regulation requirements, like any other industry. There's a regulation, but healthcare is heavily regulated industry, where we have to comply with DHA or government requirements, and we have to make sure that any of this component is licensed, and the accuracy is high, technically tested and approved. Cost also is another limitation, but to some extent, I'm sure that many of the healthcare providers in UAE have 20%, 30% of this technology. Some even hospitals have surgical robotics in their operation, and some other they have robotics for their pharmacies and their inventory. They maintain the IP and OP, or inpatient and outpatient area, using robotics. I have in my operation robotics processing and lots of automation to make the workflow easy and seamless for patients. I have the telehealth and tele monitoring services recently started. We started with the epidemic on April, and the journey has continued. We are now looking at different area to increase this this work. So yes, to some extent we can say yes, we started, but not 100%. And you know, the technology, every day there is a new, and there is always changes in technology.
Yeah, no, definitely. What are some of the health technologies that any healthcare executive should be excited about for 2021?
Well, there is lots of new technology which is really started not only in 21, but is still continued, and there is lots of work need to be done to improve this technology. If we're talking about AI and machine learning, combining the big data and rich data together to introduce it in an easy way and non-technical language to the healthcare worker and providers to support the patient. This is important, how we can employ machine learning and AI. We are talking also about chatbots, which is started already, but there is a lot to introduce in the chatbot other than what we can see nowadays. People have only Q&A built in the chatbot to provide answers for their questions, but if we are talking also about the service, what chatbot can do, or digital agent can do for patient, answer their questions, getting partially their treatment online, or help them to give them information about their health, their insurance, as well different service online on the spot. If we are talking about another technology, we are talking about virtual reality, which is playing a big role now in a healthcare organization. This is also.
How do you apply virtual reality in healthcare?
We are talking about the patient fear and how this can help in different departments to visualize the treatment in a virtual reality. In a simple example, how we can do a distraction for pediatric patient or a child during his visit to one of the clinician if he's getting injection or it's a very very simple example.
That's interesting.
So I have seen lots of demonstration about that, and the patient does not feel the physical interaction with from the physician when they start the virtual reality for that patient.
So if you have to make a bet now and put 100 dirhams on this bet, what is the number one technology that will see growth in 2021?
Voice assistance is one of the...
You need to make a bet on one.
Yes. That is a very tricky question. No, technology, there's a lot. I cannot exclude any. Voice assistance, one of the very simple, easy technology to implement, where we combine robotics plus AI to the voice assistant. Like your mobile, when you call Siri or Google Voice, you can also call the care worker or caregiver using the voice assistant, directly give the order from your room or online. Then this will answer you immediately, or can execute the order which you want. To call the nurse, to call a physician.
We're putting this on paper. Voice assistant, 100 dirhams.
Yes,
we'll talk end of 2021. What about we didn't talk about startups in healthcare. Where can you notice the biggest influence of the startup community, and in which areas are they kind of where you can see their focus, that they're contributing the most?
If you are talking about startup technology, then we should think what is the bane now for any healthcare organization. They should start from where other end to cater the problems in the data collection or storing even the data. There is a huge requirements to maintain the information records for healthcare patients for a very long time. I think they should start from the top risks where that face the healthcare provider. So this is one. Another one is the automation, and nowadays we are getting every day a new idea how we can automate one workflow, move from paper to digital, or automate the digital fully using one of the systems. If we're talking also about, as I mentioned just now, combining the big data and rich data, because this requires lots of work, lots of knowledge from the medical team or clinical team to have it embedded and visualize this data inside the hospital information system or whatever ERP they are using, make it more visual to them to take a decision. A decision support system, this is another one or another project
area.
If I'm talking about also security, and security is a big risk for lots of healthcare organizations. Recently, there is increase of around 600% security risks to the healthcare organization, and attacks increased, especially after the epidemic for healthcare worker. We have heard about WannaCry and other attacks, which is started 2-3 years back, and their main target was healthcare organization.
So having all of this in mind, startups, technology, where we were in 2000s, where we are today, if you have to describe a hospital in 2030, how would that hospital operate, and how would that whole operation looks like, and the whole service that is being provided to the patient?
Well, I partially answered this to have a very rich EHR system where the AI is built in and the machine learning is built in that system. So there is a continuous learning process for these machines from the history or the data collected by healthcare worker. Apply different algorithm or add this algorithm cumulatively to come up with decision. If you are talking about digitalization, I don't think that there in the future there should be any use for paper in any healthcare organization. Especially, for example, a city like Dubai or UAE, where we have a regulation that support this direction. For example, the e-signature and lots of initiatives to allow people not to use any hard copies, and everything should be stored online.
All right, so if I ask you to describe me the hospital of the future, so the hospital of 2030, for example, not so long future, so not so far away, 10 years only, how would you describe that hospital of the future, given the technology and the startups and everything that we talked about so far?
All right. I think partially I have answered this, mentioning one point about the combining the big data and rich data all together. And what does that mean is that we have a very large of data set embedded in the hospital information system. Each data set represents a clinical information or a clinical knowledge. So from that clinical knowledge, when a patient visit, I can get support from this data set and visualize it to a healthcare provider to take a decision. Again, decision support, but in an accurate way and easy way. That new hospital of the future, or the system of the future, should have now all this algorithm built in together. We're not talking only about the normal or traditional application for data collection. No, we're talking about build the knowledge, our medicine knowledge inside the hospital information system. I think this is one of the trend, employing the machine learning and AI, have it also built in the system. This is this would be the trend for the future, because it's a limitation as for us as a human to learn about huge data set, a huge history of different patients, to come up with meaningful information to visualize it to the healthcare worker. If we're talking about digital health and telemonitoring, I think this will increase in the future. We will not have this number of hospital and clinic everywhere that have all the specialty together to cover each and every patient requirement. But increasing the use of telehealth and telemonitoring will help the patient on the first level to cover their needs remotely, without bothering themselves about the physical access to the facility. So in the future, in the near future, we will see the hospital or the physical building will be only there for inpatient or people who need emergency, need to be admitted on a bed.
That's an interesting insight.
Yeah, that's true. We will. I don't want to say that the technology or the automation will help to reduce the human in any healthcare facility, but let's say that will help to redistribute the workers.
Human focus.
Human focus to do different routes. If we're talking about quality, for example, admin quality department, instead of only data collection and doing the traditional audit, maybe they will be more busy to do more analysis for what data collected by the machine. Same for the customer service, and instead of only helping the customer doing the traditional tasks for booking or filling the information, feeding them the computer with information, they can focus on direct interaction with patients. Technology plays rules on this, and in the future it will be the technology rule will increase to save the time for both. Voice search is also one I think in the future also will be trend. Lots of healthcare providers, they don't like to use a computer or exactly. It's always a complaint. Oh, should I focus with the computer or my patient? I have 10 minutes, I have 15 minutes that visit. But we try to make it easy for the physicians to collect the data, and I think there is now increase of voice search and voice assistant built in some of the systems. I think this will increase also in the future.
Yeah.
So robotics and the surgical robotics also will be more accurate, and there will be different technology added to this robotics to make it more accurate. For example, if you are using now 13 ml camera, tomorrow there will be 8 to do different operations, after tomorrow will be 5, 3. So the treatment will be completely different, because using the current robotics we can cover, let's say as example, I'm telling 50 to 100 operation tomorrow, using this, adding this type of technology, AI and cameras and different tools, and empowering the network with 5G, and we can perform more operations and make it more accurate, and get different providers working in the same operation, the same time, from different locations. So this is all, I think, in the future would be increasing.
I think that when you got in this industry with your role, you didn't really know that it's going to get so exciting as it is, and it's going to be more and more. Mohamed, I think it was a very, very, very insightful conversation. I had the pleasure to talk with you even before, and we talked now, and I'm super amazed with the amount of technology that is actually in the background of the service that we are providing. I'm going to keep an eye on healthcare. Hopefully we're going to find a way to work together as well. I hope you all enjoyed. There's got to be tons of questions that you want to ask, because we touched a lot of different topics. Please make sure to leave the comment, reach out directly to me or to Mohamed, and we're going to be happy to share with you some more feedback. Mohamed and I will talk again, let's say in end of 2021, just to see if his bet is going to be is he going to make some money or not. Until then, please stay tuned, follow the other episodes, and we see you next week. Take care, everyone. Bye.
Thank you.